Most people in the United States are planning to get a COVID-19 vaccine, but some may want more information before choosing to get vaccinated. Be prepared to answer questions about how the vaccines are developed and authorized. And remember to emphasize that they are safe and effective. People may have previous experiences that affect their trust and confidence in the health system.
As a running back, I took a lot of hits on the field, but I didn't want to get hit by COVID, so I got vaccinated. Don't take the hit. Get vaccinated.
I'm getting the vaccine to continue my culture.
So that I could dance another day.
So I don't have to lose another brother. Sleeves up, Nola.
Sleeves up, Nola.
Sleeves up, Nola.
By taking time to listen to their concerns and answer their questions, we can help them become confident in their decision to be vaccinated. There are resources to support these efforts. By providing communities, practitioners, and vaccination partners with the information they need to have essential vaccine conversations, we can build a culture of trust in vaccination.
Good morning, everyone. I'm Reggie Ware. I'm CEO of BlackDoctor.org, and I will be your moderator for today. Today's topic will be building trust, communication strategies for vaccine confidence, which evolves around building trust, effective communication, and then also being very innovative in our approaches. And I'll just share with you briefly some of the things that we've been able to do at BlackDoctor.org. We are the #1 health and wellness platform for Black Americans. And we are a consumer health website, but our name is BlackDoctor.org. And the reason for that is we found that the icon, Black Doctor, enables our audience to really trust the information. And so when you look at what we've been able to do with COVID, it's been pretty amazing. First off, for us to build trust, we always have to let our community or our market understand that we recognize who they are, where they are, how they feel, and exactly what they need to do to be able to sort of thrive in a very competitive, in a difficult situation. For example, for us, when the initiative came down from the top that said everybody social distance, everybody work from home, right? Well, in Chicago, they had a nice big full-page ad in the Chicago Tribune of a young, attractive Caucasian woman sitting behind her desk in a high-rise on Michigan Avenue overlooking Lake Michigan with her laptop. Everybody worked from home. But understanding our market, we knew that only 10% of Blacks have jobs where they can work from home, right? And so we started beefing up our content on how do you stay safe when you still have to go to work? How do you stay safe when you're in a multi-generational household? Things of this nature, so that we're able to connect with our audience, because our tagline is where wellness and culture connect, right? And so for us, culture it's your way of life, but it's also who do you trust? What do you share with family members and so forth? And so we always try to be relevant through numerous surveys, polls. We're asking people, what would it take for you to be comfortable getting the vaccine and so forth. And so from an editorial initiative standpoint, we were able to address all of the issues necessary to sort of move the needle from a vaccine acceptance standpoint. When we first started, we polled our audience, the 31 million Black Americans in the country, and Black adults, and we polled our audience, and we were roughly averaging around 60% of our audience saying that they didn't want anything to do with the vaccine. And this started in March. In December, January, we started seeing the tide turn, and now we're at only 27% saying they don't want the vaccine, and we're up to 47% of Black Americans saying that they want the vaccine whenever their time comes. They want to be able to get it. And so we've seen a monumental shift, and we've been testing and surveying and polling our audience on an ongoing basis. So, and what has worked? Having the top Black doctors speak from the heart with authentic messaging in terms of how they feel about it. addressing some of the difficult conversations such as Tuskegee and so forth. And, and even understanding that for our audience, everybody don't necessarily know what happened in Tuskegee, but they know something really bad happened. And so addressing those difficult tasks and so forth. And so I'm really excited about the guests that we have today. They're all distinguished experts with a really interesting story to share. And so I think the first thing we want to do is ask a poll question. So if we could pull that up, that'd be great. So we're going to ask 3 poll questions during this town hall session here. And the first one is, who's in the audience today? What type of organization do you represent? There's public health department, the healthcare system provider or administrator, a non-government health or public health organization, pharmacy, medical or public health academic institution, community-based health service organization, the government, or a faith-based organization. Please vote now. Okay. Can we see the results of the poll? Here we go. Let's see. What do we have here? It looks like we have a number of people from the government, non-government health and public health, as well as the public health department. Okay. We also have a number of individuals from the private sector. Okay, good. So it looks like we have a well-rounded audience today. Great. All right, good to see. Okay, moving right along here. I want to introduce our first distinguished panelist and also ask her a question. So Jennifer Krasniewski, Dr. Jennifer Krasniewski, is a professor of medicine, pediatrics, and public health services at Penn State College of Medicine. She is a clinician investigator with a research focus on behavioral interventions to promote healthy lifestyles in clinical and community settings. She serves as the PI for a 5-year CDC-funded REACH grant to provide the Hispanic and Latino communities in Central Pennsylvania the evidence-based tools to improve their health, prevent chronic diseases, and reduce health disparities via community-led, culturally tailored interventions. Welcome, Dr. Krasniewski.
Thank you very much, Mr. Ware, and I'm absolutely delighted on behalf of our REACH team to present some of our REACH work. So to start with, I wanted to give a shout out to the REACH program, which is CDC's forefront efforts to help reduce health disparities that's been in place since 1999. REACH stands for Racial and Ethnic Approaches to Community Health. Penn State College of Medicine was awarded a REACH project in 2018 to specifically address the health disparities for our Hispanic and Latino communities in Central Pennsylvania. As you likely know, this represents the largest ethnic group in the United States, and Pennsylvania has one of the fastest growing populations, which is up about 38% from 2010 to 2019. Nationally, we know that COVID's increased the inequities experienced by Hispanics, including increased risk of illness, hospitalizations, and death when compared to non-Hispanic whites. Therefore, when COVID arrived in central Pennsylvania last March, we knew we needed to pivot, and we're grateful to the CDC for allowing us to leverage our resources and community connections to address this challenge. If you thought information was lacking last spring in English, it's even worse now in Spanish. So to address this, we started a COVID-19 PSA campaign, which has really formed the groundwork for our vaccine. COVID and the flu season really presented a risk for a dual pandemic, and therefore CDC encouraged us to address flu vaccine. And so some of the information I'll be sharing will have flu on this, but we're hoping to pivot all of this work towards the COVID vaccine when it becomes available. Unfortunately, this is a significant risk for Hispanics, particularly because they have the lowest national vaccination rates at only 37%. So to address barriers, including lack of healthcare access and misinformation, and reduce the spread of both COVID and the flu, we conducted a social marketing campaign providing information that was both accurate and culturally appropriate surrounding vaccination and coming from trusted community figures. Our first step was engaging key stakeholders. And this included local health systems, clinics, and community coalitions, as well as their partnering organizations. These were partners who provided feedback on our campaign plans, assisted us in identifying trusted community champions, helped to review our materials, and then ultimately disseminate these materials as well. We then developed the culturally and linguistically appropriate messaging, which was related to both the seasonal flu vaccine as well as COVID. And we engaged those stakeholders to help implement messages that were focused on the disease spread, symptoms, prevention, and treatment, the vaccine, its safety and efficacy, prioritization and distribution, and the similarities and the differences between flu and COVID-19, including transparency with what is known and what was not unknown or still remains unknown. Our partners helped us identify trusted community champions to be the faces and the voices of the campaign. We have local radio station personalities, a priest, a world taekwondo champion, a restaurant and bodega owner in her traditional Mexican dress, a county commissioner. It's also important for these campaigns to think about the slogan that you're using and make sure that translates well into the other language if you have this. Our slogan was protect yourself, protect your community. These faces from our community were recognizable to the community members, and therefore they carried with them that trust. They helped us promote why they personally received the vaccine, including reasons that were their family and for their community. We leveraged print and social media campaigns using a variety of approaches to try to reach all types of people. We had billboards, life-size cutouts of our community champions in community locations, including federally qualified health centers, restaurants, and community centers, and churches. And they held rack cards, which had information that was evidence-based, but also culturally and locally tailored, including addressing the misunderstandings that we knew existed in our own community. We had yard signs and digital screens, as well as infographics, which pictorially explained the illness and the vaccine and helped to address those misunderstandings. We also provided opportunity for co-branding all of our materials by the community organizations, which made these resources freely available to them on our website and through social media. Following the development of this educational campaign, we created and facilitated trainings that were about the flu, COVID, and their vaccines for community champions. We partnered with dozens of organizations, including the National Association of Community Health Workers and our own Pennsylvania Department of Health. In all, we were able to train 130 community health workers and community leaders about COVID and increase their skills in brief motivational interviewing to help them discuss COVID-related scenarios and next steps, including plans for training them about the vaccine. We evaluated this with pre and post-test surveys, as well as a one-month follow-up to ensure knowledge transfer. And finally, we assisted with increasing vaccination opportunities by enhancing provider partnerships. Education is important, but ultimately vaccines are only effective once they're in arms. By partnering with a number of regional healthcare systems to assist them with their messaging and ensuring it was culturally tailored and available in Spanish, we helped to assist the community in their vaccination efforts. In conclusion, I would love to thank the REACH team, our amazing community partners, a shout out to Heyman Studio for their outstanding design work, and of course the CDC for this opportunity to present today. And lastly, but certainly not least, all of our attendees for all of the important work you do in your communities. And thank you for being here today.
Awesome, Dr. Kretschnushi. A very well laid out, thorough program, and excellent summary. Our next distinguished panelists, I will introduce you, Dr. Shaw, and then I'm also going to ask you a quick question. First, let me introduce Dr. Umair Shah. Dr. Shah was appointed Secretary of Health by the Governor of Washington and joined the Department of Health in December 2020. Dr. Shah comes to Washington State with extensive public health experience, most recently serving as the Executive Director of Harris County Public Health in Texas, the nationally accredited county public health agency with the nation's third largest county with 4.7 million people. So, Dr. Shah, I've got a question for you, and welcome to the show.
Thank you.
Okay. Here's your question. I understand that Washington State has a robust communications plan that includes outreach at multiple levels, a broad education campaign, identification of hesitant communities, and forums for providers. Can you talk in more detail about the role of communications as part of Washington State's vaccine confidence strategy? And what do you know that has been effective?
Well, first of all, Reginald, thanks for having me, and thanks for everyone for being a part of this panel. And I just want to join my colleagues in just saying thank you for everything that everyone has been doing. We know that this is in it together. All of us are together in really fighting these issues. And so it's great to hear just incredible perspectives. As you just mentioned, just a couple months ago, I was in Texas, and I'm making this transition to Washington in very different states, as you can imagine. And moving from that local level to the state level, moving across the country, moving from hurricanes and heat, and lately also electrical issues, as you know, with a massive storm from last week, to the Pacific Northwest with the snow and all sorts of mountains and everything else. I will tell you that though they are different, there are themes that are quite similar. And the themes that are quite similar very much are in line with what was just mentioned by you, Reginald, and the question you just asked, which is the vaccine hesitancy. Really, I think one points out a couple of things that we in this country, in my mind, have somehow had a little bit of a dichotomy of throughput and increase in effectiveness and numbers and quantity with equity and dialogue and feedback. And we've somehow figured that they are not possible to achieve both. And I think it's absolutely false. We can do both. We can vaccinate as quickly as many Americans as possible, while we can also make sure that we are doing it equitably. And so one of the things that I wanted to just mention at the state of Washington, under Governor Inslee's leadership, we put together at the Department of Health a new VAC Center, which is a public-private partnership that's bringing what I call harnessing the power of the private sector with the Microsofts and the Costcos and the Starbucks of the world, and really to help us at the state to do things even better when it comes to communications and other strategies, as well as throughput and efficiencies. But we also have launched a vaccine implementation collaboratives, the VIX, which is a combination of really, at the end of the day, in our first meeting, 300 stakeholders from communities all across Washington, communities of color, communities that have been disproportionately impacted, to really address many of those equity-based issues. We heard from the disability community. We heard from minorities. We heard from people who were very much feeling that they didn't have a voice at the table. And when we bring both of these, this throughput, but also this equity piece, what it really leads us to is the concern that right now, the supply far is limited over the demand. The demand far exceeds the supply of vaccine. but we know that it is going to change at some point soon. And when it changes, we have to make sure that all of the efforts that we're engaged in are really very much about those careful piece around dialogue and making sure it's not just about people thinking about getting vaccinated, but as we know that behavior change is a science, and we have to really work through with our champions of that message, as well as the message itself, so we can work with communities who oftentimes have mistrust or distrust or getting false information. And so this is an opportunity for us to really take that on robustly head on as we move forward with tackling these real hesitation types of very difficult conversations that are happening across the country.
Well said, Dr. Shaw. You mentioned a couple of you mentioned some really interesting points there. I really like what you said about mistrust and distrust. A lot of people don't realize that it's a big difference, right? Mistrust is you have a hunch, something doesn't feel right, that's mistrust. Distrust is based on historical data, personal experiences, and distrust is much more difficult to overcome than mistrust. And I think you're obviously, I see why you're successful. I mean, you understand what you're doing, you understand the market, and you're putting it into action. So that's really good to hear. Awesome. I'm going to move forward to the next distinguished panelist, Dr. Jennifer Avegno. She's a New Orleans native. In 2018, she was appointed as the director of health she was appointed as the director of the health department for the city of New Orleans, where she manages a dedicated team of public health professionals in addressing critical health needs for the community. Dr. Avegno currently leads the city's public health response to COVID-19 and developed one of the country's first mobile community-based testing strategies and programs with intentional core focus on equity and access. Man, I like the word intentional because I think that's what it takes to really make something happen. Dr. Avegno, welcome, and I'd like to ask you a question. Let's see here. Here's the question. Last week was Mardi Gras. I think Mardi Gras this year looked very different from many Mardi Gras of the past. Can you talk about the Sleeves Up NOLA campaign that captures the spirit of Mardi Gras? The campaign really embraces local culture. And so can you talk about how this campaign was developed and how it's been received?
Right. As you said, last week was officially Mardi Gras on the calendar, but there was really no carnival to speak of, obviously because of the dangers and what we learned, last year before we knew what awaited us. And what carnival is to us is really a shared communal event. The groundwork for preparing for our communications and outreach strategy that became Sleeves Up NOLA in part really began early in the pandemic with our approach to community-based testing. And it's, again, intentional, as you said, because it has to be focused on equity. Our team at the health department in the city has a lot of experience working with community partners and intimate knowledge of our residents and our city. And so we were able to leverage these connections in the early days to develop one of the first testing programs that put testing sites within areas that we knew had traditionally worse health outcomes, least access, highest vulnerability. And we used churches, community centers, and other trusted spaces to show our residents that we would meet them where they felt most comfortable rather than insisting they come to a place that was convenient for us. We also provided resources and direct assistance there in those critical early months so that citizens would feel that they got more than they came for and would recognize the city and the health department as a trusted partner in their health and well-being, maybe chipping away at that mistrust and even distrust that certainly is quite prevalent. So when we looked, to the task of vaccine in the fall, we built upon this network of places and community groups. We set up multiple vaccine strategy groups, in October, November, one of which is a dedicated vaccine equity and outreach groups. It's made up of a wide range of advocates, faith representatives, individuals with lived experience, healthcare professionals, and equity experts. And the first charge of this group was to develop and disseminate and respond to a survey that would inform us what were the crucial points to understand in our local vaccine hesitancy or mistrust, and also to inform how did our residents want to receive information and education about vaccines so they could make their own decisions armed with all of the information that they needed. So out of this group, out of this survey, we developed presentations, outreach materials, media posts, and other messaging to directly address what the community told us they needed to feel comfortable. Sleeves Up NOLA, and you saw a little clip of it at the beginning, is probably the best creative expression of these efforts. It's just one part of several components of our outreach strategy to get our community excited about the vaccine and the potential that it holds to get us all back to the city we know and love. Through the images and videos that we have, we build on our shared values. And I think that's especially true in New Orleans, but every community has its own shared set of values. So regardless, in New Orleans, regardless of race, age, or any other demographic, we pride ourselves on our numerous beautiful, joyous celebrations. Certainly the most notable of those is Carnival. And this came out of suggestions from our equity and outreach partners who asked that any campaign enlist New Orleans cultural icons, among others, to push the message. So our culture bearers are instantly recognizable to anyone who's ever been in New Orleans, whether you live here or not, by their unbelievably intricate, gorgeous costumes that they create every year for Mardi Gras. So they're a representation of pride for all of us. And the joy and positivity in this message, in this campaign, is by design, because we know that behavioral science research indicates that values-based messaging, so appealing to what people care about, is the best way to encourage behavior change. So not talking about what we can't do if we don't get the vaccine, talking about what our Mardi Gras Indians say, why they're getting it, what it means to them, and what joy it's going to bring. Everybody can recognize themselves in these ads, young, old, people of all ages and races. We have others focusing on faith leaders and a Spanish language version, and it's been successful. Our social media campaign has already yielded over 1 million impressions, and 97% of the reactions are either, acceptable or positive to this campaign. We've seen increase in our vaccine website traffic. It's getting people signed up. So, in conclusion, this is a team effort, and this is something that has to be informed constantly and refined by the community that we hope to serve. We're not done with it yet, and we know there are gaps that we're going to be looking to our advocates and our partners to help us fill. Thank you.
Outstanding. Great information. I've got so many follow-up questions I want to ask, but we need to keep moving here. So next up, we have another poll that we'd like to get feedback from you on. We can pull up the poll, that'd be great. Here we go. Okay, here's the second question. Right now, how do you use data to ensure communication success? And we have 3 answers here. I don't have access to data. I don't have access to data to ground communications. Or I use available inputs, including existing reports and anecdotal information. Or I use quantitative and qualitative methods to inform communication development. So be sure to input your answers now, and then we'll see what the results come out to be. Okay, here we go. Okay, good. You know, when I was reading the answers, I was hoping that the majority of the answers would be the second and the third one, right? Because if you don't have data, it's really difficult to create effective strategies, communication strategies, as we've heard and seen from the panelists that have spoken already. So the majority have available inputs, including existing reports and anecdotal information. I think that's powerful. And then the second largest response was, I use quantitative and qualitative methods to inform communication development. So good. So it looks like we are taking the data. Most people are taking the data, and then they're creating a communication strategy based off of that. That is good. And then the only thing I would add to that is we have to continually question and talk so that we're constantly up to speed with the latest developments. Okay, all right, this is good. Okay, moving right along. Our last expert, last but not least, is Dr. Kate Brookmeyer. Dr. Brookmeyer is a behavioral scientist who co-leads the Insights Unit on the Vaccinate with Confidence team with the Vaccine Task Force at the Centers for Disease Control and Prevention. Welcome, Dr. Brookmeyer.
Thanks, Reggie. Thanks so much. And I'm going to dive right in.
Okay, great.
So, yeah. So as you said, you know, data is truly our best hope for developing and implementing programs for the people. And it's our best hope for really establishing the programs that matter for lasting impact and for sustainable change. In order to increase vaccine confidence, we know that we have to gather data on 4 central factors: what people think and feel about vaccines, the social processes or social norms that drive or inhibit vaccination, and individual motivations or hesitancy for seeking vaccination. And last, you can't forget the practical factors involved in seeking and receiving vaccinations. But you know what? I hear all the time, Kate, how am I supposed to do this? Our program is so maxed out. We don't have the bandwidth. We have so many other things going on. How can we design a complex sampling frame with a huge number of participants and really get at a large enough participant that you can really get at all the segments that you really care about? And here's the thing, you don't have to do any of those things. There is a way that you can tap into data that is reliable and actionable, and you don't need a big budget or a huge sample or, God forbid, a degree in statistics. What you can do, you don't need systematic or necessarily survey-based data, but you can get data that is more than incidental or anecdotal. So first off, I would suggest that you start or restart the process of actively listening to your community. You can conduct listening sessions, which can give you an opportunity to listen to public opinion, lived experience, frustration, fears, and questions about the vaccine. Also, my guess is you have a central repository of questions or a number that people can call. You can do a question analysis and really take a deep dive into what people think are the gaps in knowledge and information, because we know that when there's an information gap and a lack of information that's credible, this is where misinformation and disinformation and rumor lives. You can also scan social media for themes. You can look at web metrics, and something that I love to do is you can build relationships for data access. Public non-proprietary data is very critical. And then you can triangulate and merge all of these sources to really have a larger understanding and a rich tapestry of the needs and the expectations of your community. Now, next, you can really involve your community partners, trusted messengers, early and often. You can be creative and work with new and non-traditional public health partners. There are organizations out there that are part of the fabric of your community and get where people live, work, and play. Think of museums, libraries, arts. Think of bookmobiles, mobile units that have access to rural and hard-to-reach communities. And you can lean into the private sector, because vaccine confidence is everyone's business, everyone's problem, and frankly, everyone's solution. And I would also suggest that you gather data always and often and engage in an ongoing process for quality improvement. You can show your community that you've listened and switch tactics as often as you need to. respond, and shift your program and message to continually build a better initiative. And create a regular rhythm for listening, communication, and feedback. And refresh your materials to combat things like risk fatigue and message fatigue. But the thing is, you don't have to do this alone. CDC's Vaccinate with Confidence team can really help you. You don't have to reinvent the wheel, and there's resources. Our team is built on 3 pillars. First of all, build trust, empower healthcare personnel, and engage communities. And the resources we have are something that I co-lead the Insights Unit. We issue and publish bi-weekly State of Vaccine Confidence Report. And we do something just that I suggested. We look over 10 forms of data input, and we sort of create a picture of what might be happening. Where are the pockets of misinformation, disinformation, and what can CDC do to really act? Also, we've got communication toolkits. We are launching rapid community assessment guides, and we even have direct support options called confidence consults, where you can build confidence for our many funded states and jurisdictions. So overall, I would say do not be scared of data. Data is powerful, it's achievable, and together we can use it to increase vaccine confidence and put an end to this pandemic. Reggie, over to you.
Awesome, Dr. Brookmeyer. Very well said, very well said. And you know, I'm sure I share the same sentiment with all the panelists, is that the words you said were strong and true. I mean, it's exactly what we need to be doing. So thank you for those comments. Okay, let's see here. Moving right along, we have some questions from, I'm gonna just throw out, I'm gonna ask a number of questions to all the panelists, and whoever wants to answer can simply just answer. So let me go with the first question that I have. Okay, here we go. Can you provide examples of where you have built new relationships during COVID-19 versus building on existing relationships for communication efforts? And let's see, who wants to answer that one?
Happy to start with that one. So I had talked a lot about our REACH program, and so we were fortunate that we had a regional network of over 100 community organizations that we were able to leverage when COVID started. But unfortunately, not all of those organizational partners were in the same space of thinking about vaccines. So there has been a need to increase the number of partners too. So we've done a little bit of both. One, the established partnerships are obviously much easier to transition to the virtual environment. I will say the new partnerships are a little bit more challenging. But one thing I've been really impressed with is every group we've reached out to is so looking forward to trying to help, that it's really helped get those team collaborations over the hump of needing to establish a relationship virtually. I also wanted to highlight a little bit about academic community partnerships. Obviously, that's our gig at Penn State College of Medicine and in our REACH project. But I would encourage folks to think about new partnerships in the academic arena if you're a community organization, or if you're an academic thinking about community partnerships. Academic expertise can include the science and communications and evaluation, which can all be really valuable for programs. But obviously, the community expertise are so critical, especially in this setting, as you've heard from all of these wonderful panel presentations. The community has their finger on the pulse of the community's needs, the concerns, and the mis or disinformation. So understanding how best to target populations can really be accomplished by a great combination of these new and established partnerships.
Wow, nice. Dr. Shaw, do you have anything that you could add to that question?
Well, first of all, I agree with what Jennifer just said. So thank you for teeing it up. You know, there have been so many horrific things about this pandemic, so many just awful things that have occurred as a result of this pandemic. But we also have to recognize that what this pandemic has done, it has actually brought together sectors and partners and relationships that otherwise probably were staying siloed. They were not going to be connected. And, you know, one of my favorite quotes is that we've spent years on collecting the dots, and it's our job to now connect those dots. And that is what this pandemic has done, because it has been such a watershed transformational event for all of us in society, right? Even the how we're doing this, we may have other times been in Atlanta to have this discussion, and we're doing this virtually, and all sorts of other partners that have now, or processes or people, all those P's of how do we really work together. And so, you know, one thing that we did last year is that we directly funded 40 plus community rooted entities for culturally responsive COVID-19 outreach and education efforts. Many of those are continuing their work. Much of our work is in different languages. Depending on which activity it is, it can be 30 languages, it can be 5 languages, it can be 40 languages. It is really making sure that we are thinking about linguistically and culturally appropriate messages that are key drivers to how we move activities forward. I talked about the public-private partnership. I talked about the VIX and the implementation collaboratives for equity. But the one thing that I do want to say from a state public health standpoint, which is the incredible partnership with local health departments, local jurisdictions, our tribal partners. It is so key and critical for us to remember that ultimately emergencies and all the different activities occur in local communities. And we at the federal level, the state level, our job is to help support what's happening in those local communities with our local partners. And so I'm just really proud of that work that's happening. But I'll tell you, this pandemic has been horrible and horrific, yet it is also brought together in a way that we have not had previously. And so there isn't always just doom and gloom. There is some hope at the end of this long tunnel.
Well said. You know, in our space with the Black community, one of the I guess silver linings of the pandemic is the formulation of the Black Coalition Against COVID, and it's formed by Dr. Reed Tuckson. And what he's been able to do is bring all of the Black organizations, the Black medical schools, the NMA, I think the National Urban League, and the Black Nurses Association. He's been able to bring everybody together and get everybody on the same page in terms of the things we should be saying about COVID, the things we should be saying about building trust and so forth. And so what BDO, Blackout.org College shows BDO, what we've done is we house all of this information and content. So there's one resource, one location where people can go to get all this information. And again, just talking about new partnerships, how it's brought everybody together and really energize people to just be on the same page and communicate. So awesome. All right, this next question is going to be for you, Dr. Kate Brookmeyer. What are some of the innovations you may be exploring right now?
Okay, thank you. And I'm glad you asked that question. One thing that we're really excited about, we're excited about a lot of things, but one thing that we're really excited about on the Vaccinate with Confidence team is our burgeoning ability to create really interactive and easy to use and clear maps. Mm-hmm. So what we are trying to do is take your map, take the most finite granular level map of your community that we have, overlay it with vaccine allocation, vaccine distribution, vaccine administration, because we know in this pandemic, supply and demand are not the same thing. It's a totally different picture than what you would typically see with, say, flu. Take that. Then superimpose your vaccination sites. Are they where they should be? Are they where people are living? Are they where people can get to easily? I would argue that in this moment, they're not necessarily where they should be. And so this will show us how can we improve and how can we give this feedback back to the community, back to our community organizers, back to our state and local health departments. Also, I would superimpose on that morbidity. How has this pandemic affected the community? On top of that, you can put social vulnerability, comorbidities to see what's happening. And last, and I think this is the most exciting part, we're hoping that we can actually put vaccine confidence overlaid on top. This will really allow us and you to look and see, are there pockets of vaccine hesitancy in my community? Where are those pockets? How might be people being affected? Who are they? What do they do? How can we reach them? And in turn, create tailored and local interventions, prevention efforts, communication strategies. And I'm hoping that CDC will be able to use these maps and you will be able to use these maps. Over.
Very interesting. Dealing with culture, one of the things that we've noticed with the vaccine dissemination, vaccine location piece is that the first fear was that there would be sort of these vaccination deserts in the Black community. And I know the CDC and others have worked to make sure that this didn't happen. And you can probably tell that from your maps, right? But what has happened is that because of culture, so I'm based in Chicago. So the vaccine locations that are in the Black neighborhood, in the hood in Chicago, right? Whites from outside the community, that want the vaccine, they're going to, if they're qualified, they're going to call and they'll come into the community to get their vaccine, which makes perfect sense, right? But the Black community, they're not being aggressive or proactive enough to get the appointment set. So by the time they make the call to get the appointment set, right, all the appointments are gone. Now, the culture piece is whites will come into the Black community to get their vaccine, but Blacks won't go out of the community to get theirs, right? So, so it's just so many interesting dynamics that are happening here. So, and I'm sure you're seeing it from the CDC with what you're tracking with the confidence.
Yep, I am. And you know what? My sister's in Chicago, and I think what you're saying plays out. I think you're 100%. You're 100% on that.
Yeah, good deal. All right. The next question I have is for Dr. Avegno. And the question is, what are we doing to speak to individuals in their own culture and language, which is really important?
Yeah, it really is. And first of all, you have to know your community. You have to know what are the cultures, what are the languages that are there. For us, if we're talking about our non-English speakers, it is Spanish and Vietnamese. And those are the main two groups. And there's others, but really, we focus on those because that's our highest percentage. Well, because of our work, we've done a lot of work with Spanish language advocates, as well as our Vietnamese, community groups. We started that with testing. We were able to identify that we had a real problem in the Hispanic community very early on because we deliberately partnered with trusted churches and Hispanic groups to put testing there and solely market to our Hispanic residents so that we could get an idea of what the issue was. So again, it's building on that. Our registration site is both phone and online. And Reggie, I think you hit upon that when you were talking about Chicago. If we just do things online, we will completely replicate an inequitable system because that is the way the system is designed to reward people with lots of internet access, time, and good transportation. So for us, it has to be both, particularly when we're talking about our non-English speakers. Our online is translated into Spanish. And we have, when we do scheduling, we call and we will have a Spanish language speaker call individuals identify either by the phone or online that they are a non-English speaker. And that allows for us to have someone call them in their native language to schedule, because it is impossible if you do not speak English to talk to someone who does and try to figure out how to get vaccinated. Our campaigns all of our COVID messaging has been translated into both Spanish and Vietnamese. So whether that's printouts that we handed out at the site, whether it's flyers that we have now, we have done outreach to media outlets in Spanish. One of the highlights of my last couple of weeks doing outreach was going to Vietnamese church in Vietnamese and getting up in the church service and being directly translated into Vietnamese to reach a community that really is somewhat isolated. So it is all of the strategies. It's not just one. It's not just, if you go to this site, it'll be in some language. It has to be print. It has to be on the ground. It's got to be faith leaders. It's got to be radio, TV, social media, in whatever the languages are that make the most sense for your community.
Yeah, smart. You know, I what I hear is that you didn't try to dictate what the market needed. You listened, and then you gave them what they needed. That's it's an excellent way of communicating to an underserved population group. Okay, this next question, I'm going to just pose it to all of the panelists, and I'd love to get your feedback on this. Okay, here's the question. What have you learned over the past year that will help you help your work over the upcoming months as the vaccine continues to roll out? In other words, what is your biggest lesson learned about building vaccine trust and confidence? Let's see, who wants to answer that first? Okay, gotcha.
Jump in, and I did want to say one quick thing, Reginald, which was on the previous question. I did have the opportunity when I came into this position a few weeks ago to meet with African-American faith leaders in South Seattle. And I will tell you that one thing that resonated with me is when they said that they had a passion for taking care of those who have the least and have lost the most. Least and lost was the real term. And so when you talked about Chicago, and it really does resonate with me that this is an all-in approach across so many geographies. Remember, I'm coming from a very different place, Harris County, Houston, very diverse community, and quite urban, going to the state of Washington, which has a mountain. I'm not sure if you all know a mountain range right in the middle that divides up the state between the western side and the eastern side. And I was able to go and visit and recognize that the themes and the issues on the ground, whether you're in a large jurisdiction or a smaller one, whether you're in an urban or a rural, whether you are in communities of color, whether you are in less diverse communities, that the misinformation, disinformation is absolutely critical. So what I have learned this year is that this is a super slick virus that has broken every rule in the playbook. We recognize that plans are so important. Planning is key, but pivoting as those plans require us to. So last week, we know that vaccines were delayed across the country because of weather. We couldn't have predicted that a month ago, 2 months ago, or even a week ago, yet that's what happened. And we now have to pivot to make sure we're able to respond. So if we believe that everything that all of us have laid out is going to go absolutely perfectly all the way through the end of this pandemic, and by the way, we are going to get to the end of this pandemic eventually, guess what? I've got news for you. We're going to have to evolve. We're going to have to pivot. We're going to have to continue to rely on our ingenuity and innovation, our partnerships, so we can get to that finish line. So anyway, just wanted to add that last set of lessons and also what that road ahead looks for, at least from my perspective.
Awesome.
Yeah, I would agree with that. I'm an emergency physician by training, and that is our mantra, right? What you expect will never be what you get, and it will change. And so anticipating that change is key, and not being disappointed when things do change. So that's been a lesson for us. And I think the other lesson is you have to be deliberately looking for the ways that you are not succeeding. So if you are going to set up a vaccine distribution and it's going to be X, and you say, great, everybody's signing up. There's plenty of people on the wait list. We've done our job. Then you're going to fail. You have to be looking at those who is not getting the vaccine? Why aren't they getting the vaccine? If we just use a system that is dependent on online, who are we disenfranchising? How do we deliberately undo it? We have a wait list of thousands and thousands of people, but we're really looking at that wait list and seeing who is coming from a high social vulnerability index census tract with high needs, low access, and a significantly elevated risk of death from this disease. And how do we prioritize their vaccine, over someone that is going to be fine if they can wait another week? And so for us, it's constant. It's often by hand. There's not many great technologic solutions for that. So it's just good old fashioned public health, gumption.
Awesome.
Absolutely. I agree with everything that Jennifer said. And, I would also add, and just like Dr. Shah said, I would also add that this virus is really, really smart and really tricky and just keeps throwing us for loop after loop after loop. And so when we're communicating with our communities, I think it's so critical that we're transparent about what we know and what we don't know. I think, acknowledging uncertainty is okay. And frankly, it builds trust. There's been so many uncertainties. And if we can just let people know what we're uncertain about, why we're uncertain about it, and when we think better data is coming, I think that really goes a long way. And along with that, I would just say, listen to your community and then listen harder and listen again. It never ends. And that's the way to get good messages out there, and good messages that actually might communicate and might get us closer to the end of this.
Those were all fantastic answers. So what can I add to sort of wrap that up? I think the piece that I would focus on is look for partners in places that you may not traditionally look for partners. I really appreciated Dr. Shah's earlier comment about the dots and connecting those. Each time that we have a chance to talk with community, they introduce us to somebody else that we should know and that we should be reaching out to and we should be working with. So keeping an open mind, because we do have to pivot at every corner with this pandemic. And it's only through creative problem solving that we're going to be able to address some really wicked problems that have plagued the country for a long time. These discussions of equity and the bright light that's been shined on the health disparities. And I'm hopeful as part of this work that we will continue keeping these dots connected and continue these partnerships to help address disparities beyond, once we can safely say the pandemic is behind us.
Well said. Okay. We're moving along very, very nicely here, and we are on time. So what I want to do is I want to backtrack just a little bit. And when you all were talking about your respective programs, I know we had a tight time window that we had to have all of you talk, but we have extra time now. And so those of you that, I sent the chat, hey, wrap it up. If there were other things that you wanted to say about your program, could you please share it? Because I think everybody listening clearly understands that what you're doing is cutting edge, and it's been very effective and it's compelling. And so I don't want to leave anything on the table that I want to make sure everything's on the table so that our audience can learn from. So are there any other pieces of your presentation, any of you that you wanted to continue to share while we have such extra time?
Reginald, this is probably not the right thing to do as a moderator, is to ask us to expand on something. That's always danger. It's like the big D's coming out there. So, but I will say I appreciate that question, because the one thing I would expand on is this real, and it was brought up a bit ago about technology and innovation. We absolutely talk about creativity and people coming together and partnerships, and there is a real concern. It's the pros and the cons of technology, right? We absolutely recognize how fantastic it can be to bring people together. Social media, or even ways of getting technology solutions to advance activities that we would have never thought we could have done. And we as public health have to own that we need to, it's not even us necessarily, our policymakers, to invest in public health. So this underinvestment over the decades can actually include technology solutions. So when we are faced with calamity, we're not sitting there trying in the middle of a disaster and emergency, trying to build a system, which is exactly what we did, which is not the way to do it. And it cannot happen again. And we must ask better from our country. So that is one. But the second thing is really that there is also the negative of technology, where we do know that there are technology gaps and there are access issues. And so if we put everything on social media, we put everything on a website, or we rely only on technology solutions and recognize or fail to recognize that there are people in many communities who do not access or cannot access those technologies or those modalities because we have not made them accessible with that digital divide, then we're also going to further the inequities. So we've got a real opportunity in the midst of this challenge to really step back up, to really transform our country, thinking about how we can not just use technology, but how we can make sure that all can benefit from those technology and innovation solutions.
Okay. Okay. Now you bring up an interesting point, and your point is that technology can't reach everyone, right? And so for us, what we've learned is that our goal, of course, is to reach everybody in the Black community. But we understand that if you want to reach everybody in the Black community, the one thing you can't do or shouldn't do is try to reach everybody in the Black community. The goal is to reach the key influencers, right? The people that can then turn around and talk to their family members and friends and so forth, because word of mouth is what's going to really drive total engagement, right? And so for us, we leverage technology to reach all of the key influencers within their respective families and key communicators. And then they in turn talk to their family members. I was talking to a psychologist the other day, and he said, hey, you know, my great grandmother's not on the internet, so how are you going to reach her? I was trying to get her to, I was telling her she needs to get the vaccine. I'm just trying to figure out how you're going to reach her. I said, I'm reaching her through you. You're talking to her about the vaccine, right? So it's mission accomplished. And I think that's the role of technology, not to reach everybody, but to reach everybody that can then turn around and talk to other people, because technology, these smartphones here, you know, are definitely changing the game. The other thing I'll talk about while we have some time that I've seen on our end. So, you know, in the Black community with the distrust and so forth, you know, the Black culture is sort of a subculture, right? And a subculture is formed whenever there's an announcement of something that's good for everybody. It always benefits everybody but a certain group of people. And so the subculture becomes very distrusting on any overall national initiatives, right? And so with the vaccine, one of the things we wanted to control, a narrative and messaging that we wanted to control once we saw that Blacks were really wanted the vaccine, was we wanted to control the narrative that, oh, well, Blacks are so distrusting of the vaccine that we shouldn't put distribution centers in the Black community because it's too valuable. I mean, we can only put them in places where people are going to get them, right? And so what we did through with the help of the Black Coalition Against COVID is to talk about the number of Blacks that want the vaccine so that we could control that narrative of, well, you don't need to put it there because they don't want it. And if you notice, there hasn't been an overarching theme of distrust of the vaccine with Blacks. Now, initially it was, and we addressed that, but moving forward, now you're saying, okay, well, how do we get more Blacks to be able to receive the vaccine? And some of it's logistics, and in addition to some of the other issues that may be, you know, prevalent. Anybody else want to share any other comments?
Sure, I can jump in. You know, one thing I want to be clear that all our listeners are aware of is really all the resources that are out there to help you. So here's the thing. We've got the Insights report that's coming out every 2 weeks that can give you a look at burgeoning and emerging trends and misinformation and disinformation and rumors that might be affecting your community. You know, there's also our toolkits, communication toolkits that are geared towards everything from essential workers, community-based organizations, medical centers. And we've got rapid community assessment guides to diagnose and address vaccine confidence barriers among sometimes very specific populations. And we're always looking to add more resources. And we also have direct support options in case you're a part of a locality, a jurisdiction, or state that you feel that there's pockets of vaccine confidence issues, we can potentially help you if you're funded, and we can even send a strike team out to really help you on the ground. Over. And I agree that it's always a little bit dicey, Reggie, to ask a group of docs and PhDs to expand on their opinions on things.
Let me apologize for that. No, you're absolutely right. I didn't think about it until you mentioned it. Okay, well, I do have another question. So the question is, and this is to all of you, and it's a personal question. What does a COVID-19 vaccine mean to you personally? Dr. Brookmeyer, why don't we start with you?
Oh, all right. What it means to me personally is, Reggie, I have 3 sons. They're 5, and then I have twins who are 2. And what it means, yeah, it's quite a thing. So what it means to me personally is, my sons that are 2, they are really young, and they haven't seen my mom and dad, their grandparents, in about a year. And so what it means to me is, my mom and dad can get vaccinated. They just had their last shot on Saturday. It means that they can start to build a relationship with their grandchildren that, they haven't necessarily been able to yet. I mean, they've missed out on a lot of milestones. They know who their grandparents are, but, maybe, I want to give them the opportunity to love my mom and dad just as I do. So we in my family are just so thrilled that finally, our older, our most knowledgeable people are that we trust are getting vaccinated. And for us, it's going to mean that we come together again stronger.
Awesome. Dr. Vegno, same question.
Yeah, certainly, like Kate, I just want to hug my mom and dad personally. And it's exciting. They've gotten their series because they're older, and I've gotten mine. So we're inching closer to that day. But I think, being a New Orleanian whose family has been here for hundreds of years, and understanding that our culture is a multi-generational culture, who does many, many things together, loudly, hugging, singing, laughing, whether it's a parade or something else, and to see that cause the deaths of so many in our community. It's really, you couldn't have designed a worse pandemic for our community. And that affects us all. It certainly, as a health director, I mean, every death is personal to me, because that is a loved one. And I don't know anybody who doesn't know somebody. We're a very close-knit community. So just to get back to being able to, have people over to the house, or, have a picnic, or just share in the way that for hundreds of years our community has done, there will be no one more excited. I will lead the parade when that day comes.
Awesome. Dr. Kresnewski, same question. What does a COVID-19 vaccine mean to you personally?
The COVID vaccine to me means hope. And I can say that as a primary care doctor who gets to spend most of her time doing public health research, which is my passion. I've had to take my time in the hospital to help with the COVID surge and see the healthcare workers struggling to care for patients, and see the patients and their families struggle with limited visitation in these just unbelievable times. If you had told me as a resident doctor that I would be in this situation, I wouldn't have believed you. Using a mask for a week when it used to be just thrown out after a visit. So for me, the COVID vaccine represents a chance to go back. Obviously, we don't want to go back unchanged. I think this is going to bring the silver linings that this group has done such a great job highlighting as well. We want to go back changed, but we want to go back.
Awesome. And Dr. Shaw, what about you?
Well, I was going to say hope. So, I think I got this is always the challenge of being the last person, right? It's like, oh, that's what I was going to say. But it really is, the miracle of science. If you could go back with all the incredible, just horrific things that were happening last spring, and you could fast forward a year, and you could say a year later we would have, for example, in the state of Washington, more than 1 million vaccines that have been administered, or across the country, the millions of vaccines that have been administered, or for an administration to say 100 million vaccines in 100 days. That is quite incredible, incredible. And it's such a precious miracle that we have 2 vaccines right now that are 94, 95% effective, which is just incredible. I mean, that's really the word. And as a healthcare provider, received my 2 doses, my wife as well, and my 83-year-old mother received her 2 doses, it really is the hope for the future. It is that we have done everything to fight this pandemic, public health, healthcare, and beyond, community members. And we now have an opportunity to end this pandemic once and for all. And I really hope that we don't lose that opportunity because of misinformation, disinformation, and lack of trust. When it's our time, what I say is don't hesitate, vaccinate. When it is our time, and we know people are frustrated. I can't get the vaccine today. My grandmother can't get the vaccine today. I'm in this occupation, I can't get the vaccine today. The time will come where that vaccine is available. Do not let that opportunity be wasted. Get the vaccine when it's offered to you, because that's our way out of this pandemic. This has been a long, dark tunnel, and we see light at the end of the tunnel, but we're nowhere near it unless we get vaccinated. So that's what this represents to me.
That makes sense. I echo a lot of the sentiments that you shared, and it's really about, it's about family. They always say the best things in life are free, right? And you mentioned that priceless. I want to hug my parents. I mean, those are the things that really matter most. And the vaccine can help us get back to those, to be able to share those precious moments. And so I share the same sentiments you all have shared. All right, so this is really good. I'm going to ask one more question, and then we're going to do we're going to go over the takeaways. And any one of you can answer this question. This is for a question that came from Tessa from Ohio. And she asked, are there real examples of trust building from a communication standpoint? Are there real examples of trust building from a communication standpoint? Anyone want to jump on that one?
I can jump a little bit, with our campaign, using our culture bearers. That they are wonderful, amazing individuals, but over the years, their work has been exploited. And so certainly we did not want to give the impression of that. We did not want to just sort of use them for this great campaign and then have them not have any benefit. We have, relationships with, and particularly our videographer, our camera person is sort of, deeply connected to that community. And so it was going and really asking permission or working with trusted intermediaries and advocates to explain the nature of the campaign, why it was important, make sure that they were educated and felt comfortable to participate in a campaign, and that they did not feel that we were just sort of using their faces to put on a billboard and that it wouldn't benefit them or their family or their community somehow. That could have been very tricky, and it could have not gone well. But we put in the work up front to make sure that everybody felt comfortable with what was going to be the final product, particularly those who were doing the representing.
I was just going to add to that was in Harris County and now in Washington, the use of promotoras and outreach workers, staff members, volunteers at times who are of the community and can give back to the community with trusted messages, but also knowledge. I think that's a real opportunity for us to continue to support the incredible work that's happening in that real outreach effort on the ground.
Great. No, this is great. Okay. All right. We have a final poll question that we'd like to pull up on the screen. Get some more feedback. This has been an extraordinary session, guys. Really appreciate all of your input and expertise. This is awesome. Okay, the poll question: which strategy have you relied on most for communications to build vaccine confidence? Again, which strategy have you relied on most for communications to build a vaccine confidence? Using data. The first one is using data to ground communication strategies in local contexts and realities. Identifying and cultivating relationships with trusted messengers. Making vaccine confidence visible to help build social norms. And the last one, engaging people across multiple formats and channels. And we'll wait for your answers. All right. So we have our results. The number one response is engaging people across multiple formats and channels. Number two was identifying and cultivating relationships with trusted messengers. I think that's really critical. And then the third most was making vaccine confidence visible to help build. Okay, good. This is good. All right. Now, I've got a couple of things I want to share with you before we close this session up. We want to encourage you to share information with each other on the forum discussion board throughout this event. Join us there right after this town hall, where CDC experts will be available to answer questions for the next hour between 3 to 4 p.m. Eastern Standard Time. Also, check out the Learning Center for more resources related to COVID-19 vaccination. And maybe put up a link to show where that is. Okay, that's probably in the chat. It's in the chat room. All right. Well, I want to thank everyone for your passionate, intelligent, and insightful perspective on in sharing the work that you've done. I think that we all know that there's much more work ahead, but I think we all can take some pleasure in understanding that, you know, we made some progress here. We're seeing it a little bit clearer, a little bit better, and we have to continue to learn, continue to try new things, and leverage all the resources that we have. And we're going to get through this pandemic, and it's going to be a pleasure meeting. It's going to be a pleasure regrouping again once we're on the other side of this thing, and just talk about just how well things are now and all the work that we've done. So thank you so much for everything you've done. And we're over and out. Oh. Woo! Sorry about that. Got too excited. The key takeaways. My captain finally put up the key takeaway. Hey man, what took you so long? No, okay. Here are the key takeaways from what we've done today. Communication strategies. One is to use data and information to ground communication strategies in local contexts and realities. Identify, cultivate relationships with, and train trusted messengers to share clear, credible communication. I think that's really critical. Emphasize transparency, credibility, empathy, and respect in communication materials. Engage people across multiple culturally responsive formats and channels. Another really, really important point. And then make vaccine confidence visible to help build social norms. Yeah, strong takeaways. I'm sure we could talk another 20 minutes on each one of those. But again, thank you for your help, participation, the information you shared. I think along with myself, I think the entire audience got a lot of great information. And we thank you. And now we're closing for sure this time. Thanks, everybody. Bye-bye.